Assalamu alaikum and good morning to one and all. Today we'll study about catatonic and anti-catatonic activity, which is also called as anti-Parkinson activity, by using perphenazine induced catatonia. I am Professor Sheikh Abu Sufyan. Welcome you to AS Academy Learning Forever. At the end of this e-learning session, you are able to discuss aim, requirement, method, and principle of studying catatonic and anti-catatonic activity, and based on given data, analyze and interpret the result of the bioessay. Let's see the aim and objective of this bioessay. So this essay, it having two aim and objective. The first objective is to study catatonic activity by using perphenazine induced catatonia in the rat. So try to remember, perphenazine, basically it is antipsychotic drug, belong to the category of phenothiazine, and it having ability to produce catatonia. So first you are studying catatonia by using perphenazine, and catatonia, it is the side effect of the perphenazine, it is not their primary pharmacological action. So you are studying this side effect of phenothiazine. So drug belong to this category we are using today is perphenazine, okay. And then once this is induced, then we can also study anti-catatonic activity. Now the drug which having anti-catatonic activity, they are also called as anti-Parkinson drug. So we are going to study anti-catatonic activity or anti-Parkinson activity in again perphenazine induced catatonia. So we'll be studying two activity. One, it is we'll be studying side effect of the perphenazine, that is catatonia, and secondly, by using this model, we'll be studying anti-catatonic or anti-Parkinson activity. Now let's see what are the requirement for this experiment. So to conduct this experiment, you need animal which having the weight in between 180 to 230 gram. So again it is very flexible and is depend upon your protocol. Sometimes it is between 150 to 200. Sometimes some researcher, they prefer taking the animal with body weight between the range of 200 to 250. So it should be in the range, right? It should not be very high. Like it should not happen that you are selecting the animal of 100 gram and second animal it is of 200 gram. So there should be the proper range. In between that range, you need to select the animal to conduct this study. Secondly, the apparatus which is used for study of this experiment. So you don't need to have the special apparatus or the instrument to study this experiment. You just need to have two wooden blocks. The one wooden block having the height of just 3 centimeter. Okay, so the 3 centimeter height wooden block, so you will be using that, and second wooden block having height of just 9 centimeter. So you will be using two wooden block to evaluate anti-catatonic or catatonic activity in a rat. Secondly, you will be using the drugs. So you are using again two types of drug. First type of drug you are using specially to induce catatonia, because in order to study anti-catatonic activity, you need to first induce catatonia. So you will be inducing catatonia by using perphenazine, because catatonia, it is the side effect of perphenazine, and we will be seeing in its detailed principle and mechanism by which it produces the catatonia. Okay, so first drug we have used, it is the perphenazine, and second drug we need to use, it is to test anti-catatonic activity. So to test anti-catatonic activity, we will be using the drug belong to the category of anti-Parkinson drug. So we will be using the scopolamine, we generally having anti-Parkinson activity. So these are the requirement of this experiment. Now let's see the principle of the experiment. So we know that especially antipsychotic drug. These antipsychotic drugs, they are broadly classified into two categories. One, it is typical or classical antipsychotic drug, and second one, it is atypical antipsychotic drug. And this classification, it is based on their extrapyramidal side effect. So classical or typical antipsychotic drug, they have extrapyramidal side effect, whereas atypical antipsychotic drug does not have extrapyramidal side effect. So while studying this experiment, you should not select a typical antipsychotic drug because it does not having extrapyramidal side effect and it will not induce the catatonia. Okay. Whereas if you want to study catatonic or anti-catatonic activity, you must select classical or typical antipsychotic drug. So example belong to this category. It is phenothiazine like chlorpromazine, butyrophenol like haloperidol, or you can select the thioxanthine. So amongst any drug from this category, you can select for conducting this experiment. Okay. So when you select classical or typical antipsychotic drug, what is the characteristic of those drugs? Just now I have mentioned these drugs, they having extrapyramidal side effect. So when these drugs are given to the animal or injected to the animal, they show extrapyramidal side effect such as akinesia. What is akinesia? Akinesia, it is impairment of voluntary movement. Like if you want to move from one place to another place, and if you can able to do that, it means your movement it is normal. But if you are willing to move, but in spite of your willingness, you are not able to move. So that is called as akinesia. Likewise, second thing, it is the rigidity. What is rigidity? Rigidity, it is resistance to the passive movement. Like you want to move and you want to move with high speed, right? So speedily you want to move or you want to run, but you are not able to move with that speed that you want to move, isn't it? So you are moving very slowly. So why you are moving slowly? Because you have resistance to the passive movement. So that is called as rigidity. And like third symptom, it is the tremor. So these are the three characteristic feature of extrapyramidal side effect. So in addition to this, many other severe side effects are also there. But for this experiment point of view, these two symptoms, that is akinesia and rigidity, it is important because we are going to evaluate today's experiment based on these two symptoms, that is akinesia, and second thing it is the rigidity. Okay. So my point to be remember here is typical antipsychotic drug, they show extrapyramidal side effect and patients show the symptoms such as akinesia, rigidity and the tremor. And if you see the symptom of the Parkinsonism, then in Parkinsonism also patients suffer from rigidity, tremor and akinesia, right? So these symptoms collectively they are called as Parkinson's like symptom. Okay, so they are also called as Parkinson like symptom. It means when phenothiazine, butyrophenol or thioxanthines are given, it produces the extrapyramidal side effects which is similar to the Parkinson like symptom. Okay, so when you give this drug, antipsychotic drug at excessive dose, it has ability to produce the Parkinsonism. So when you are giving this drug at high dose and you give anti-Parkinson drug, you can easily evaluate anti-catatonic or anti-Parkinson activity of those particular drugs. Okay, so since these symptoms are called as Parkinson like symptoms. Okay, so where there is difficulty to move and change the normal posture, and this the indication that is difficulty in changing the posture, it is a very important characteristic feature of the Parkinsonism. The patient sometimes unable to change the posture, or sometimes when he has raised the hand and you want to bring down that hand, so in spite of willing to bring down that hand, sometimes he is not able to do that. So what is this? He is unable to change the posture. So these parameter, that is the patient not able to change the posture, and that is specially due to the akinesia, okay, and rigidity, it can be evaluated in animal model, and which is resemble to the akinesia and rigidity which is seen in the patient suffering from the Parkinsonism. So this is basic principle of this experiment. Now let's see what is mechanism behind this akinesia, rigidity or extrapyramidal side effects. So before going ahead, you must know that both Parkinsonism and psychosis are opposite disorder. So let's quickly see what exactly happened in case of Parkinsonism and what happened in case of psychosis. So the main neurotransmitter which is affected in both the disease, it is same, that is dopamine. So although there is a role of even 5-HT is there in schizophrenia as well as Parkinsonism, but important neurotransmitter which play important role in case of Parkinsonism, it is the dopamine. So let's see what happened in case of Parkinsonism and how their dopamine level it is affected. So I am writing the Parkinsonism as a P. So in case of Parkinsonism, there is decrease in level of the dopamine. So dopamine level it is decreased in case of Parkinsonism. Okay, and what happened in case of psychosis? So again, psychosis I am writing as a PSY as a psychosis, so you can distinguish. So in psychosis it is exactly reverse. So in Parkinsonism dopamine level it is going down, whereas in case of psychosis level of dopamine it is increased. So dopamine level it is increased in case of psychosis. Okay, so these are exactly opposite. When you give antipsychotic drug, now what they are doing exactly? So in case of classical or typical antipsychotic drug, example phenothiazine, butyrophenol and thioxanthin, they produces excessive decrease in level of dopamine. Why they produce excessive decrease in level of dopamine? Because you are giving anti-dopaminergic drug. You are giving the drug which can block the level of dopamine so that you can control this excessive increase in level of the dopamine, isn't it? So the excessive decrease in level of the dopamine, especially in extrapyramidal motor pathway, the patient will show the Parkinson like symptom. Otherwise, if there is decrease in dopamine in other pathway or other part of the brain, that is generally done by a typical antipsychotic drug, since they decrease the level of dopamine in other part of the brain, it won't produces Parkinson like symptom, because Parkinsonism it is associated with decrease in level of the dopamine, especially in extrapyramidal motor pathway. So and this is what exactly drugs are doing, because you are giving this drug to treat the psychosis and to treat or to reduce the level of the dopamine, because level of dopamine it is increased in case of psychosis. So to control that you are giving. So when dose of this drug it is more, then what this drug will do? This drug will bring down the level of dopamine below the normal, and when the lower level of dopamine coming below the normal, patient will start showing the symptom of Parkinsonism. So I hope you understood the mechanism. So we are using antipsychotic drug belong to the class of typical antipsychotic or classical antipsychotic drug to reduce the level of dopamine in extrapyramidal motor pathway and to produce the Parkinsonism. Okay, and the Parkinson like symptom like the catatonia and like rigidity and akinesia, right? And once you induce this Parkinson like symptom, now you can give anti-Parkinson drug and see how much catatonia or akinesia or rigidity it is decreased by your anti-Parkinson drug, right? So this is how this experimental model work. Now let's go to the procedure. So to perform this experiment, first important thing is yes, the first important thing it is number of group and the treatment. So do remember that to perform this experiment, what you need to do, you need to select the two group. So the first group it is the control and second group it is the test. And in both the group, each group having n is equal to 5. What is n is equal to 5? It means each group has the 5 animals. Means you have selected 5 rats in each group having the weight between 180 to 230 gram. So whatever weight range you select, you must stick to that weight range so that the body weight should not affect your experiment, isn't it? So that is actual objective of selecting the animal in particular body weight range. Okay, so when you select first group, that is the control group, so in control group you need to just give inducing agent. So what you are giving perphenazine. So the perphenazine it is the drug to induce the catatonia. Okay, so you have given inducing agent that is the perphenazine. Whereas in test group, you have first given the scopolamine. So scopolamine it is anti-Parkinson drug. Okay. So first you have given the scopolamine, and after 30 minutes of administration of scopolamine, you have given the perphenazine. I hope you got this protocol. So control group, what you have given? You have just given the perphenazine. In test group, first you have given the scopolamine, and after 30 minutes of administration of the scopolamine, now you have given the perphenazine. Okay. So what scopolamine will do? Since you have given scopolamine before inducing agent, now scopolamine will try to protect the animal from catatonia or rigidity and akinesia which is induced by the perphenazine. So when you see the activity in this group, here you will see the more catatonic effect. So catatonia specifically, it is the term which is used in case of the animal model, and it's resembled to the condition of akinesia and rigidity in human being. So just remember, when you are giving perphenazine, you will see the increase in catatonic score when you have only given the perphenazine. When you have given the scopolamine before the treatment with the perphenazine, you can see there is clearly decrease in the score of catatonic activity. Okay, so the catatonic score, it is decreased because now here you have given the scopolamine which is anti-catatonic or having anti-Parkinson activity, isn't it? Since you have given that, it will decreases the catatonic score. What is the second thing? It is the observation of severity of catatonia. How much amount of catatonia it is produced, or what is the intensity of catatonia which is produced by the perphenazine. So to evaluate this, based on catatonic score measured at different time interval, that is 15 minutes, 30 minutes, 45 minutes, 60 minutes, 90 minutes and 120 minutes, especially after administration of perphenazine. So you need to observe your severity of the catatonia based on catatonia score that you are going to measure at this time interval after administration of perphenazine. It means you have administered scopolamine, 30 minutes after scopolamine you have administered perphenazine, and immediately after administering perphenazine, after 15 minutes of administering perphenazine, you will be first time measuring the score. Likewise, you can measure the score after 30 minutes. Okay, then you will measure the score after 45 minutes, then you will measure the score after 60 minutes. So you can repeat the same measurement of catatonic score for 15, 30, 45, 60, 90 and 120 minutes. Again, this time interval you can change based on your experimental protocol. So there is no fixed time interval. You can have the flexibility based on your test drug that you want to test, or investigator can modify the protocol based on what he desire, he feel best. Okay, so this is how you can design the protocol. Now let's see or how to give the catatonia score. So catatonic score of control group. So first we will see in control group. So what we have given in case of control group? So in control group, we have given perphenazine. Okay, so in perphenazine, suppose if you are measuring catatonic score, then there are specially 4 stages are there to measure catatonic score. So and each stage it indicates the severity of catatonia. For example, the stage 4, if there is maximum score, it indicates there is maximum catatonia or rigidity, it is induced in the animal. So suppose you have given perphenazine and after 15 minutes of that, you have kept that animal on the table. Okay, so when you have kept the animal on the table and rat moves normally, when placed on the table, you will be giving the score that is equal to 0. So this stage it is called as stage 1 and score is equal to 0. Okay, so since score is 0, that indicates that the drug has not yet induces the catatonia. So it is the stage 1. There is no severity of catatonia, it is yet observed. Okay, whereas in stage 2, same animal, when you are kept on the table but it is not moving. So it is not moving because this is the behavior of the animal or the rat. Whenever you are keeping at any open space, he will not stop at one place, he will start moving here and there. So when animal it is kept on the table and rat moves only when touched or pushed. So when you are touching that animal or you are pushing that animal, then only rat moves. It means catatonia has started inducing in the rat. Now what score you will give in such condition? You will give the score that is equal to zero point 0.5. Okay, so you have given the score that is equal to the 0.5 because catatonia it is induced. Now this is we have seen in case of the stage 2. Now in case of the stage 3, the rat's front paw, it is placed alternately on 3 centimeter high block. So what you did is you have kept the front paw of the rat on the 3 centimeter block, and when animal failed to correct the posture in 10 seconds, then again you will give the score. Now generally what happened, like especially in your case also, if I ask you to keep your hand up for more time, then what will happen, there will be the pain and you will not able to do that for more time. Likewise, the animal will also not able to tolerate a backward posture for more time. So when you keep the animal on in stressful posture or a backward posture, that animal will try to correct the posture. So this is the behavior of normal animal. But if catatonia it is induced, now what is the symptom of catatonia? There is rigidity, there is decrease in there is impairment of the normal movement of the animal. So due to this, that animal will fail to correct the posture in 10 seconds, isn't it? Now since that animal failed to correct the posture in 10 seconds, again based on your observation, suppose if the animal has failed to correct the posture in 10 seconds with right paw, means he is not able to remove his right paw, you will be giving the score of 0.5. Okay, now secondly, when you have kept the left paw and if animal unable to correct the posture or fail to correct the posture in 10 seconds, then again you will give the score 0.5. So sometimes what happen, animal unable to correct both the paw, both the right as well as left paw, then in such case you will give total score of 1. Okay, so you will be giving total score of 1 because during left paw when you are kept up, animal is unable to correct the posture. When you are kept the right paw up, again animal is unable to correct the posture, so score is 1. Suppose animal has corrected his left paw but unable to correct the right paw, then in such case what will be the score? Score will be just 0.5. Suppose if animal has corrected the posture in 10 seconds with both the paw, then in those case the total score will be the 0. Okay, so this is how you will be giving the score in case of the stage 3 of the catatonia. In case of next stage, that is the stage 4, what you did is we have used second block. So we have seen in requirement we are using the two wooden block, one having the height of 3 centimeter and another wooden block it having the height of 9 centimeter. So now instead of 3 centimeter, now we have used the block which having the height of 9 centimeter. So when you kept the front paw of the animal at the height of the 9 centimeter, in such case if animal is failed to correct the posture in 10 seconds, then what you will be doing, now you have increased the score. So earlier when animal is unable to correct the posture with the right paw, you have given 0.5, but since here this condition it is too much strange for the animal, so you can increase the score. Instead of 0.5, you can increase the score to 1. And likewise, when animal fail to correct the posture in 10 seconds for left paw as well, then you can give one more score, that is 1. So suppose if animal is unable to correct the posture for both the paw including left as well as the right paw, then in such case total score will be a 2. So especially in case of perphenazine, when it produces very severe catatonia, the animal show the severe catatonic score. So for example, the stage 0, if the animal it is not moving, then what you will be doing, you will try to push that animal or touch that animal, and when that animal it's move, when only touching to that animal, then you will be giving first score, that is 0.5. Then what you did, you have used the 3 centimeter block, you have kept the animal front paw on the 3 centimeter height, and animal failed to correct the posture with both the paw, then 0.5 will you have given for the left paw. So I'm writing here 0.5 for the left paw, okay, and then you have given 0.5 for the right paw because both the paw animal is failed to correct the posture. Now in stage 4 what you did, you have increased the height of the wooden block, okay, and both the paw animal unable to correct the posture. Then what's total score you will be giving? For the left paw you are giving 1 and the right paw again you are giving 1. So what could be the maximum score if there is a very severe catatonia? So maximum score in case of very severe catatonia will be 1 plus 1 2 plus 0.5 it is 1 2.5, then 0.5 will be 2, so it will be 3, and plus 0.5 will be 3.5. So maximum score in case of very severe catatonia if it is induced by perphenazine will be 3.5. So this is how you will evaluate or you will give score specially to the animals. Okay. Now in case of observing catatonia score of test group. So in test group what you did? You have given scopolamine, and after 30 minutes of administration of scopolamine you have given the perphenazine. Okay. So in such case when you observe the score, obviously in stage 1 rat move normally when placed on the table, score is 0. In stage 2 you have seen that rat move only when touch or push, so that is not the case because rat it is moving normally, so total score it is 0 only. When you have kept the animal front paw on the 3 cm high block, you have observed that animal failed to correct the posture in 10 seconds. So in case of right paw animal has corrected the posture, so you have given the score 0. Whereas in left paw it is observed that animal is failed to correct the posture, so you have given the score 0.5. In stage 4 when you have seen the observation, you see that when you kept the animal front paw at 9 cm height block, you observe that animal unable to correct the posture for the right paw, so you have given the score 1, but he has corrected the left paw, so you have given the score 0, and total score here it is 1. So when you have given the drug that is scopolamine, and after that when you have given the perphenazine, your total score observed was, so in stage 1 and 2 it was a 0, okay, plus in case of the stage 3 you have got a total score of the 0.5. So how much score it is coming? It is coming to the 0.5, okay, and in case of stage 3 when you see the score, you have got score only of the 1, okay. So how much is total score is coming? So total score coming after administration of scopolamine it is 1.5. So this score may change from animal to animal and at different time interval. Maybe at initial stage there will be the less score, and when you see the score at the peak plasma concentration, that is generally seen after 1 hour of the administration of the drug, when you may get the maximum score. So this is how you are going to evaluate anti-catatonic activity in case of scopolamine and perphenazine. Now let's see about interpretation of the result and calculation part. Okay, so let's move to the Excel sheet. So what you can do is, first thing is that in this experiment you are using two drugs. First it is perphenazine and second one it is scopolamine. So you need to first calculate dose to be administered for each animal based on their body weight. For example, in case of perphenazine, what is the dose? It is 5 milligram per kg. Now, since the dose it is 5 milligram per kg means what? It is for 1000 gram. Okay. So 5 milligram it should be given to the 1000 gram of animal. But now what is the original weight of your animal? The original weight of your animal it is 180 gram. So you will be doing cross multiplication and you will be calculating the dose. So how you will be doing that? So 5 multiplied by 180 divided by 1000. So now you got the dose that is 0.9 milligram for the first animal. So likewise you can calculate the dose for other animal. So this is in case of control, since you have only given perphenazine, so you need to calculate dose only for the perphenazine. But in case of the treatment, you have to give both the drug, perphenazine as well as scopolamine. So you need to calculate dose for both scopolamine as well as perphenazine. So when you calculate dose for scopolamine, you need to calculate it for 2 milligram per kg, because dose you are giving for the scopolamine it is 2 milligram per kg, and in case of perphenazine it is the 5 milligram per kg. So the way I have shown for these dose, you can calculate the dose for the treatment group as well or test group as well. So what is the difference? In case of the control group, you need to calculate dose only for the perphenazine, whereas in case of the treatment group or test group, you need to calculate the dose here for the scopolamine, and here you need to calculate the dose for the perphenazine. So this is the first task that you need to do, that is calculation of dose to be administered for the each animal based on their body weight. Now second part, if you see the observation table, so what observation table show? Observation table show the mean catatonic score after minutes of perphenazine treatment. So first observation was noted after 15 minutes of treatment with perphenazine. Second observation noted after 30 minutes of treatment with the perphenazine. Likewise, third after 45, fourth after 16 minutes. Sixth observation, it is noted after 120 minutes after administration of the perphenazine. So you have measured the score. So when you measure the score, at initial level when you measure the score, you see the score may be coming to only somewhere like 0, and somewhere you are getting the score to 0.5. After 45 minutes you are getting everywhere score 1. So maybe this maybe the score is of the stage 3 or the stage 4. Okay. Likewise, at 60 minutes when you see the score, maximum animal it show the score more than 2. So here the fifth animal show the score 2, or most of the time you got a maximum score, that is the 3 score. Okay. Whereas after 90 minutes, the 2 and 3, it is coming between 2 and 3, and after 120 minutes the score is coming between 0.5, 1, 2, 1, 1. Okay. So when you take mean of this, so how you will be taking the mean? So is equal to average. So I will show you the demo. Okay, so you will be applying the formula, you will select those rows. Now you will get the mean for this. Okay, so mean after 15 minutes of the treatment, and if you drag this till the end, you can able to calculate mean for you will able to calculate mean catatonic score after different minutes of administration of perphenazine. So after 15, 30, 45, 60, 90 and 120. Okay. Likewise, when you see the score of scopolamine and perphenazine, now you can see here, since you have administered the scopolamine, what scopolamine does? It increases the level of dopamine. Since it increases the lower level of dopamine, it reduces the symptom of Parkinsonism. So it reduces the catatonia, that is the rigidity and akinesia, which is induced by the perphenazine. So when you take these, the mean of the treatment group, so when I am taking the mean, so I am writing the average. So don't get confused. In Google Sheet, same the mean, I am calling it as the average. Okay. So when you put this in the formula, you will get the average. So you can see here after 15 minutes, the score is 0. When I drag it, I will get the score or the mean catatonic score after different time interval of the test group. So when you compare both these score, what I did is I have made separate table, and this table I have already applied the formula. So whatever reading is there, so here whatever reading is there, that will be reflected over here. You can see here. So 0.4 now it is reflecting over here. Okay. Now this 1 it is reflecting over here, and likewise this reading for the test group it is also reflecting over here. So when you compare this summarized table of mean catatonic score after different interval of perphenazine treatment, you can easily see there is decrease in mean catatonic score in scopolamine treated group as compared to the control group, that is only perphenazine treated group, that indicate anti-catatonic or anti-Parkinson activity of the scopolamine, because the catatonic score it is decreased. So decrease in catatonic score, it means the animal is able to change the posture, isn't it? So that is the reason why catatonic score it is decreased. So if animal is able to change the posture, it means his movement it is improved after giving the scopolamine, that indicate anti-Parkinson activity of the scopolamine against perphenazine induced catatonia, right? So this is how you can conclude the result. Now, but in order to have the graphical representation, because in a research paper or when you put any result in a presentation, you need to give the graphical representation. So in those cases, you need to draw the graph. So let's see how to draw the graph. So what I'm doing, I am selecting the summarize result, right? I am going to this graph, okay, and just clicking that graph. Now you can see the graph, it is drawn directly in the Google Sheet, okay. Now if you look at this graph, what is missing? Y-axis is missing, that is very important. Whereas x-axis it is given, that is control and perphenazine, and this is for the test group. So since y-axis is missing, you can add the y-axis. How you will add it? So I am selecting this graph. You can do the right click. When you right click at this, you can go to the chart axis and title. And what is the y-axis here? Y-axis, it is vertical, right? So this is the y-axis. So I am selecting the vertical axis, okay? And when I select vertical axis, it will show this portal where I can add the title of title text for the vertical axis. So what should be the y-axis here? So y-axis, it must be a mean catatonic score, okay. So it is mean catatonic score, that is the y-axis. So the moment I have type here, you can see it's come on the y-axis, okay. So you can change the font size, you can change the font color, you can use make use of the Google wonderful function of the Google Sheet to draw this graph, okay. So I have drawn this graph, my y-axis is ready. Now still one thing is missing. What is that? The title of experiment is missing. Even that title also you can add. So you can again go to, you can do the right click over here, go to the chart axis, give the chart title, okay. What was the title of the experiment? Study of anti-catatonic activity. Then induced catatonia, okay. So you have given the title. Now you can see the title is also reflected. So your job is done. So your y-axis is ready. Your x-axis, it is the treatment which is already there. So you can see the two types of graph. So the first graph, it is of control, second graph, it is of test. So in graph also it shows that there is decrease in catatonia score in case of the test drug, that is scopolamine, as compared to the perphenazine. This indicate anti-catatonic activity of scopolamine, okay. And there is increase in catatonic score in perphenazine. This indicate that perphenazine produces or induces the catatonia. So there are two interpretation for this. First interpretation is, in case of perphenazine, there is more catatonic score. This indicate the catatonic activity of perphenazine. It means perphenazine produces the catatonia as a side effect. In case of second graph, when you compare with the first one, you see there is decrease in catatonic score. In case of the scopolamine treated group, this indicate anti-Parkinson activity of scopolamine treatment group, okay. So this is how you can do the experiment. Once you're done with this, you can copy paste your observation table in your e-journal and you submit that as assignment so that I can give you a marks, okay. So I have done with my today's session. So thanks for watching the session. If you like this session, then do remember to give me a thumbs up, and if you are not subscribed yet, then also subscribe to my channel so that you can get the alert for different content that I share in on my YouTube channel.